Good morning, doctors. Pharmacology. Today we are going to do pharmacology. Pharmacology is a very important subject. Why? Because it is highly scoring subject. If you practice it well, it will be very easy for you, and you can solve a lot of questions in medicine and pediatrics from pharmacology itself. And this pharmacology is the basis of the clinical subjects. So let us begin with the first question. Number one, anandamide is A. Opioid, B. CK1 antagonist, C. D2 blocker, D. Cannabinoid. Anandamide. Anandamide, also known as N-arachidono-ethanolamine, N-arachidono-ethanolamine, or AEA, arachidono-ethanolamine, AEA, is an endogenous cannabinoid neurotransmitter. The name is taken from the Sanskrit word ananda, which means bliss, delight, and amide. It is synthesized from N-arachidono, N-arachidonyl phosphatidyl ethanolamine by multiple pathways. It is degraded primarily by fatty acid amide hydrolase, Fa. It is degraded primarily by fatty acid amide hydrolase, Fa, enzyme, which converts anandamide into ethanolamine and arachidonic acid. As such, inhibitors of Fa leads to elevated anandamide levels and are being pursued for therapeutic use. So the correct option here is B, cannabinoid neurotransmitter. So anandamide is a cannabinoid neurotransmitter. Now this question is very important. GP2B3A inhibitor are all abciximab, eptifibatide, tirofiban, except prasugrel. So the correct option here is prasugrel. Prasugrel. Now GP2B3A, that is glycoprotein 2B3A inhibitor. The platelet glycoprotein mediates platelet aggregation via binding of adhesive protein such as fibrinogen and von Willebrand factor. GP2B3A inhibitor inhibit platelet aggregation by blocking GP2B3A. They are more complete inhibitor than either aspirin or clobetasol because they inhibit the final pathway in platelet aggregation. The drugs are abciximab, eptifibide, tirofiban, lamifiban. So the correct option here is prasugrel. Prasugrel is not a GP2A, GP2B3A inhibitor. Mode of excretion of cyclophosphamide is it is kidney. Mode of excretion of cyclophosphamide is kidney. So the correct option here is kidney. Cyclophosphamide is primarily metabolized 80% and metabolites are excreted in urine. 10 to 20% is excreted unchanged in urine and 4% is excreted in bile. So mode of excretion of cyclophosphamide is kidney. Beta 2 agonists cause beta 2 agonists cause some most common side effects of beta 2 agonists are muscle tremor and palpitation. They also cause hypokalemia. They don't cause hyperkalemia. So the correct option here is A, hyperkalemia. Clinical effect of vitamin D is reduced by simultaneous ingestion of phytates. Now what happens to vitamin D? Let us see in detail. In vitamin D is important for absorption of calcium, intestinal absorption of calcium. The main clinical effect of vitamin D is enhanced intestinal absorption of calcium. When you intake of 1000 milligram of calcium, intestinal absorption is only 150 to 250 milligram per day. Calcium is absorbed mainly in the duodenum and jejunum, that is proximal intestine, by an active transport mechanism, which is regulated by 125 OHT, OH2D calcitriol. Paratherma indirectly promotes absorption of calcium by increasing the renal synthesis of 125 OH2D3. Dietary lactose, protein, and an acidic environment promote calcium absorption. Dietary lactose, proteins, and an acidic environment promote calcium absorption. On the other hand, phytates, phosphates, oxalates, tetracycline, and an alkaline environment impair calcium absorption. So the correct option here is A. Simultaneous ingestion of phytates. Sugamdex is used for Sugamdex is used for A. Organophosphate poisoning. B. Reversal of neuromuscular blockers. C. Treatment of local anesthetic poisoning. D. Treatment of anticholinergic syndromes. Sugamdex is a novel reversing agent developed for terminating the action of non-depolarizing muscle relaxant rocuronium and vecuronium. It is a modified cyclodextrin with high affinity for rocuronium and vecuronium. It encapsulates one molecule of NM blocker within its molecule, forming an inactive chelate which is excreted in urine. Its side effects are mild precordial pain, nausea, and alteration of taste, and rarely allergy. So Sugamdex is used for reversal of neuromuscular blockers. Acidic drugs bind to A. Globulin, B. Alpha 1 glycoprotein, C. Albumin, D. None. Many natural substances circulate around the body, partly freely in plasma water and partly bound to plasma protein. For example, cortisone, thyroxine. Similarly, drugs circulate in protein bound and free states. And the significance is that free fraction is pharmacologically active, whereas the protein bound component is a reservoir of the drug that is inactive because of this binding. Acidic drugs generally bind to plasma albumin. Basic drugs bind to alpha 1 acid glycoprotein. Binding to albumin is quantitatively more important. So, the acidic drugs bind to albumin. Duration of action depends on duration of action depends on A. Clearance, B. Rate of elimination, C. Bioavailability, D. All. The correct option here is B. All. Which of the following drug can cause thyroid dysfunction? Which of the following drug can cause thyroid dysfunction? A. Amiodarone, B. Ampicillin, C. Ibutylide, D. Acyclovir. The correct option here is A. Amiodarone. Dopamine, all of the following is true except causes increase in GI ischemia. Correct option here is A. GI causes increase in GI ischemia. Dopamine is positive inotropic. Dopamine improves renal perfusion. Dopamine causes vasoconstriction. It causes decrease in it causes increase in GI circulation. But here it is given ischemia, so it is wrong. The side effect of digitalis are A. Ventricular tachycardia, B. Vasodilatation, C. Nausea and vomiting, D. Ventricular Gemini, bigemini. The correct option here is vasodilatation. Digitalis causes mild vasoconstriction, not vasodilatation. So correct option here is B. Anti-androgen used in heart failure is spironolactone, C. spinal nerve. Gemcitabine is used mainly in pancreatic cancer. Maximum liver toxicity is seen with which anti-TB drug? Pyrazinamide. Fastest acting antithyroid drug are. Fastest acting antithyroid drug are. Antithyroid drug is again very important. Iodides of Na plus and K plus. Iodides of Na plus and K plus. Iodides of Na iodide and iodine is the fastest acting thyroid inhibitor. Most important action is inhibition of hormone release, which is also known as thyroid constipation. But all facets of thyroid synthesis may be affected. Excess iodide inhibits its own transport in thyroid cells and may alter the redox potential, thus interfering the iodination. So the correct answer here is A. Natalizumab is used in treatment of Natalizumab is used in treatment of multiple sclerosis. Now, how to treat multiple sclerosis? Treatment of acute attack by corticosteroid, prednisolone are used. Treatment with disease-modifying agents that reduce the biological activity of multiple sclerosis. Disease-modifying agents for multiple sclerosis are interferon alpha 1A, glatiramer, natalizumab, fingolimod, mitoxantrone, cladarabine. Other treatment options are methotrexate, cyclophosphamide, IV immunoglobulin, azathioprine. Symptomatic treatment, healthy diet, regular exercise. Treatment of rigidity, baclofen, diazepam, tizanidine, dantrolene. Treatment of weakness, potassium channel blockers like 4-aminopyridine. Treatment of pain by anticonvulsants, carbamazepine, phenytoin, gabapentin, pregabalin, or antidepressant. Treatment of UTI, bladder dysfunction, constipation, depression, and cognitive problems. So the correct option here is A, multiple sclerosis. Special feature of glargine insulin is it produces smooth, peakless effect. It produces smooth, peakless effect. Glargine is a long-acting biosynthetic insulin. It remains soluble at pH 4 of the formulation and precipitates at neutral pH on subcutaneous administration. Onset of action is delayed. It produces a smooth, peakless effect. It is suitable for only once daily administration. Low incidence of nighttime hypoglycemia. It does not control mealtime hyperglycemia. So the correct answer here is A. It produces smooth, peakless effect. Mechanism of action of trilostane is Mechanism of action of trilostane is trilostane. It was previously sold under the brand name Metoril. Is a medication which has been used in treatment of Cushing syndrome, Conn syndrome, postmenopausal breast cancer, but it was withdrawn for use in humans in United States in 1990s. Subsequently, it was approved in veterinary medicine. The medical use it has been used in the treatment of Cushing syndrome, hypercortisolism, Conn syndrome, postmenopausal breast cancer. So, contraindication: Trilostane should not be used in pregnant women. Trilostane should not be given to a dog that has kidney or liver disease. Now, side effects of trilostane include gastrointestinal side effects like gastritis, nausea, vomiting, diarrhea. So, it 3 beta hydroxysteroid dehydrogenase inhibitor. C. Treatment of choice for cheese reaction is, we all know it is phentolamine. Treatment of choice for cheese reaction is phentolamine. Cheese: certain varieties of cheese, beer, wines, picked meat, and fish extract contain large quantities of tyramine, DOPA. In MAO-inhibited patients, these directly acting symptomatic escape degradation in the intestinal wall and liver. Reaching to systemic circulation, they displace large amount of Na from adrenergic nerve endings. leading to a hypertensive crisis, cerebrovascular accidents. This can be treated by IV injection of rapidly acting phentolamine. Prazosin and chlorpromazine are alternative, but choice is phentolamine. Essential drugs. Essential drugs. Essential drugs as those that satisfy priority healthcare needs of majority of population. So the correct option here is C. Post-marketing surveillance is used in which phase of clinical drug trial? It is phase 4. Post-marketing surveillance. Phase 4. Surveillance after marketing, also called post-marketing surveillance, after the drug is out in the market, is a part of phase 4 of clinical trial. It includes follow-up of patient and taking who follow-up of patients who are taking the drug and adverse drug reaction reporting, as well as looking for newer treatment indications. It is phase 4. Which of the following is most active against slowly dividing tubercular bacilli? It is rifampicin. B. Rifampicin. So the correct option here is B. Drug contraindicated in G6PD deficiency are chloroquine, primaquine, quinine. All. Yes, correct. All of them are contraindicated. Antimalarial drugs, primaquine, quinine, and occasionally chloroquine can cause hemolytic anemia in G6PD deficiency. But primaquine has the highest potential to cause hemolytic anemia in patients with G6PD deficiency, and patients with G6PD deficiency are highly sensitive to primaquine, and it causes hemolytic anemia. So the correct answer is D. Which of the following anti-cancer drugs are competitive inhibitor of tyrosine kinase? Competitive inhibitors of tyrosine kinase. A. Amantinib and suntinib. B. Letrozole. C. Bicalutamide. D. Fulvestrant. Competitive inhibitors are imatinib, nilotinib, sunitinib, dasatinib, erlotinib, geftinib, lapatinib, sorafenib. Monoclonal competitive inhibitors. Monoclonal antibodies, cetuximab, panitumumab, monoclonal antibodies, trastuzumab, targeted antibodies, zemtuzumab, that is anti-CD23, rituximab, anti-CD20, alemtuzumab, anti-CD52, vascular endothelial growth factor inhibitor, bevacizumab, proteasome inhibitor, bortezomib, histone deacetylase inhibitor, varinostat, DNA methyltransferase inhibitor, 5-azacitidine, 2-deoxy-5-azacitidine, all transretinoic, biological response modified, recombinant IL-2, adelsecin, denileukin. So the correct answer here is imatinib and sumatinib. Ranibizumab, a monoclonal antibody against ranibizumab, monoclonal antibody against VEGF, vascular endothelial growth factor. So it is correct option here is C, VEGF. So let us once again quickly revise all the MCQs. Anandamide is a cannabinoid neurotransmitter. GP2B3A inhibitor are all abciximab, FT, fibatide, tirofiban except prasugrel. Mode of excretion of cyclophosphamide is by kidney. Beta 2 agonist cause all except hyperkalemia. Beta 2 agonist cause hypokalemia. Clinical effect of vitamin D is reduced by simultaneous ingestion of phytates. Sugammadex is used for reversal of neuromuscular blockers. Acidic drugs bind to albumin. Duration of action depends on clearance, rate of elimination, bioavailability, or which of the following drug can cause thyroid dysfunction? It is amiodarone. Dopamine, all of the following is true, except causes increase in GI ischemia. The side effect of digitalis are all except vasodilatation. Digitalis causes mild vasoconstriction, not vasodilation. Anti-androgen used in heart failure is spironolactone. Gemcitabine is used mainly for pancreatic cancer. Maximum liver toxicity is seen in which anti-BB drug? It is pyrazinamide. Fastest acting antithyroid drug is iodides of Na and K. Natalizumab is used in treatment of multiple sclerosis. Special feature of Glargine insulin is it produces a smooth peakless effect. Mechanism of action of trilostane is 3-beta hydroxysteroid dehydrogenase inhibitor. Treatment of choice for cheese reaction is phentolamine. Essential drugs, those that satisfy primary healthcare needs of the population. Post-marketing surveillance is included in phase 4 of clinical trial. Which one of the following is most active against slowly dividing tubercular bacilli? It is rifampicin. Drug contraindicated in G6P deficiency is chloroquine, primaquine, quinine, all. Which one of the following anti-cancer drug are competitive inhibitor of tyrosine kinase? Imatinib and sunitinib. Ranibizumab is a monoclonal antibody against VEGF.